Hello, everyone. I am Leslie Enriquez, and it's my pleasure to welcome you to the first episode of Let's Talk Community Health Real Issues, Real Action. This space has been created by Dia de la Mujer Latina. And every month, we're going to come in Facebook and YouTube. Facebook at Dia de la Mujer Latina, YouTube at Dia de la Mujer Latina, YouTube. Once a month, we're going to be talking with different community health workers and talking about issues and real action. Let's start today with some community health workers that came to Houston a few days ago, and let's hear what they had to say. Now we are here with
Benita Perales.
Benita Perales, CHW from Corpus Christi, Texas.
I am a CHW instructor and I am from Corpus Christi, Texas, and the surrounding area. I'm actually from a little town called Robstown, about 20 minutes away.
And tell us, what are the challenges that you guys face over there?
The challenges would be the distance in between. We do have Corpus. However, many of the colonias are 20, 30, 45 minutes away in areas where people are not getting the services that they need because they don't have the ability to get to the place where they need to be serviced. They don't have, whether it's the money or the transportation, or maybe they're not knowledgeable of the services that are being, whether it's in the Nueces County, San Patricio, Clayburgh, because that's all the surrounding counties where we're at.
Anything else you would like to add?
We need more people to be involved, to understand. We need our medical area. They need to know, hey, we're here to help you. Give us that opportunity. Let us get out there. Let us help the people. And the funding. The funding is not there. Many times, that's why it's so difficult to reach out to the people, because there's no funding to get to them.
Amelia Day from Houston.
From Houston, tell us, what are the challenges that you face in the Houston area as a community health worker?
That's a very good question. Our resources and barrier to get to the resources. So it's more about being visible in the community, making certain you bring those resources to the community and to meet those individual needs and those family needs.
And how do you help them?
In every way I can, by connecting them with various agencies, by bringing agencies to them, by contacting individuals to let them know, hey, I have this family that needs whatever resource they need. And so just making certain we bring that connection together with them to make the difference, whether it be with healthcare or even food.
We have many challenges. We still have a lot of myth, especially when it comes to some of the health issues. You name it, it could be diabetes. So misinformation out on social media sometimes create an issue with our communities because they get confused. And we as our community health workers try to clear those myths, try to explain them, guide them, bring in research to them so that way they can make positive changes on their life. It could be different areas, when it comes to going to their regular checkups. It could be men's where, more often we have more issues for men to go do their regular checkups versus women's. So that is very important, and we have to break some of the barriers for them. One of them is creating their own, believe on their own to go to the doctor and find out what the issue is versus being afraid of finding out what problems they may have. So that one of the things that we definitely as a community health workers work hard on, and it's on a daily basis. So anytime we have an opportunity to communicate or to talk to someone, we try to gain that trust to guide them and bring those resources to each individuals in need of that.
And we continue with Let's Talk Community Health. And right now, it's our pleasure to introduce you Venus Ginés, the founder of Dia de la Mujer Latina. Thank you for joining
Leslie,
us.
I am so excited. We've been doing Hablando Entre Nos, and it's a program for promotores all over the country where they're sharing what's going on in their community. And many of our community health workers say, hey, when are you going to do something for us that don't speak Spanish? And here we are. It's Let's Talk Community Health. We're going to be looking at the real issues and things that are happening in the community. But more importantly, we're going to actually work with our community health workers to promote action.
And I know that for a few years, people have been asking, when are you going to have the English version of this program? Tell us why you decided to create this space for community health workers.
Well, I think the research is showing that community health workers, these trusted members of our community, if trained the right way, where they have the core competency skills, they can debunk misinformation, which is one of the sources of many problems that we have in our community, is people are relying on conspiracy theories. So we also have an opportunity for community health workers to build those interpersonal relationships and build trust, because who better than to build trust than somebody who's from your community, who's kind of lived a lot of the issues that you're living. So community health workers are key, and we have been blessed with a great advocacy program in our organization, where we brought over 300 community health workers to Austin in 2023, and we advocated for certain bills to pass, and they passed unanimously, which means that they were there sharing their lived experience, and at the same time brought the issues to light to some of their legislators and their representatives. So I think that is key. And then they're really good at when it comes to knowledge base on specific diseases. Right now, we're hearing so many people are dying from this, or so many people are having these kind of surgeries, and what's going on in the country. People start getting scared. This way, we are being trained on each of these diseases. What are the risk factors? What are the signs and symptoms? We're going to present all of that in our Let's Talk Community Health.
And I know, because definitely, as you said, CHWs play a crucial role in our communities. And all around the country, we're going to be talking about different issues. And what about if we hear about what they had to say during their visit in Houston a few days ago? And let's remember, this week, the National Organization of Community Health Workers is celebrating CHW's Awareness Week. And how important is that for our community?
It is, again, it's highlighting this invaluable work of community health workers, and the fact that now we are starting to recognize that they need to be integrated in all aspects of health and wellness.
Definitely, Venus. Thank you so much for joining us today. And we'll see you every month. And now we're going to hear more about CHWs.
María Covernali, directora ejecutiva de Familias Triunfadoras. Well, in El Paso, there's a lot of challenges, especially on medical issues. Yeah, there's a lot of challenges because our people, immigrant people, that right now, they having a hard time for medical services.
How do you help your community?
How we help the community, we help the community like enrolling them on community clinics where they don't ask for Social Security. That's the way, and even giving them classes of prevention. And sometimes we find tools, resources for them.
Anything else you would like to add?
Well, I think the promotoras de salud, CHW, are a bridge between the community and entities that they have resources. So we advocate for them, and I love to be a CHW.
And what are the challenges that you have in Dallas County? What you've seen in the community?
I'm seeing the community, they need more important education in all the steps, nutrition, care.
So challenges, I do notice that there's a lot of resources that are out there that other people might not know about and are not informed, so they're not able to take advantage of those good resources that they're out there. So as a community health worker, I take my role seriously, and it's very important to find the resources and share them with other people in the community that might need.
And then also you keep on training yourself, so that way you can pass that information to the people around you.
Yes, yes. Always more information that we can find. And now, as a case manager for children and pregnant women as well, finding different resources to help accommodate the needs of both pregnant women with of health risks and of children with any other medical needs.
Right now, one of the challenges is that people they don't want to come anymore to the programs. They feel scared. They're afraid. They don't want to come to the programs that we offer for them.
And there are free programs, right?
Free programs, preventive health. Like for example, we have DPP classes. That's a preparation class diabetes, and we also have Tu Salud 50. That one offers free exercise class in two counties, Cameron County and Hidalgo County, and we see that we don't have enough people like on other times.
And people are not attending because they're afraid of immigration operations and so forth.
Yes, people think that if they go there, or sometimes when we enrolling people, they asking us, this information is gonna be shared with other people or
Agencies.
and we say no, but oh no, let me think about it. They scared.
How do you help your community right now? It's challenging times, of course, but how do you help your community on a daily basis as a community health worker?
I teach a exercise class on one of the churches on my community, and I also encourage people to come to the classes because these classes are very important for them, so that way we can prevent a lot of diseases.
In Eagle Pass. Well, the first challenge that I'm having right now is that our funds got cut. So we're no longer having the Navigator program in Eagle Pass. They will be helping out from El Paso and El Valle, but it's not the same thing as a person is helping someone, right? As an individual, one-on-one. So that's one of the first things that we're having a challenge on. We have a lot of diabetes, we have a lot of cancer, we have a lot of domestic violence. We only have one hospital in our place, and it's a private hospital. We do have two clinics where we refer our people, but it's a really small town. There's no employment at all. So if you have a job, you stick with it, and it's really hard to find a job there. That's some of the challenges we can see there in our communities. They're not seeing what's happening up there. We're seeing we don't have enough programs to provide education on health issues to our community. So that's what we're facing. Substance abuse. We have a lot of substance abuse in our community too. And we only have one program of substance abuse in the community. So yeah, that's some of the challenges that we have as community health workers. We do have a group of community health workers in Maverick County, and I'm glad to say that we're about 75 community health workers there in the community. Not everyone is active, not everyone has a job, but we have that group, and we connect together and see of services. We do have a chat where we communicate of events. So that's what we're doing right now.
And how do you help your community?
How do I help them? I try to help in everything. As leaders of community, I've been in the community for almost 26 years as a community health worker. So I'm la viejita, I'm the old one there. So I'm the one that motivates them to get certified and to go to classes. And how do we help them? Well, partnering up with other agencies to do back to school health fairs, vaccines, getting out the information out there. So all of the community health workers have information, the same information to give out.
Thank you for all you do. And anything else you would like to add?
Well, I invite everyone over there in any community to be certified as a community health worker. Help your communities. We can't do changes in our communities so our communities can be healthier.
So make sure you follow us because once a month we're going to be talking about real issues, real action, and community health worker talk. So follow us, Facebook at Dia de la Mujer Latina, YouTube at Dia de la Mujer Latina, YouTube. And make sure to share this so more people get all this information. See you next time.